Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, Professor and Doctor. My name is Rizki Amalia Juwita from Department of Anatomical Pathology, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Yogyakarta, Indonesia. I will present my research proposal, the relationship between CD30, NS3, and Eber expression as a prognosis factors in patients with non-Hodgkin's T-cell lymphoma. As background, non-Hodgkin lymphoma or NHL is ranked 7 for cancer in the world every year. 4,056 patients are diagnosed with NHL based on clinical features according to WHO, and is classified by two types. T-cell lymphocyte and B-cell lymphocyte. For the B-cell lymphocyte account for majority of cases, with T-cell lymphocyte accounting for the remaining 10%. From our hospital, Juwita Hospital, from 2016 until 2020, NHL was diagnosed for 215 patients. For CD30 in determining the treatment and prognosis of NHL, a recent study showed that CD30 immunohistochemical staining plays an important role. CD30 is a tumor necrosis factor receptor that is only expressed on lymphoma cell and has very little cross-reactivity with normal tissue, so making it an excellent target therapy. And in here we can see the anaplastic large cell lymphoma with CD30 positive have a better prognosis than CD30 negative. Malignancy is linked to HIV infection, hepatocellular carcinoma, and lymphoma, the most common cancer linked to HIV. The optimal management of HIV positive patient with NHL has yet to be determined. Here we can see the connection between HIV and non-Hodgkin. In here, we see the cytokines E2, CD81, HCV protein B-cell infection, and become the sustained B-cell activation or HCV-induced mutagenesis. The sustained B-cell activation will combine with the genetic and or environmental factor. For HCV mutagenesis will be the BCL2 overexpression, B-cell apoptosis inhibition, and will be the prolonged B-cell survival. And the genetic and also prolonged B-cell survival become together, make mixed seroglobulinemia or additional genetic aberration, and will become the non-Hodgkin lymphoma. So this is for the B-cell. How about the T-cell lymphoma? For the T-cell lymphoma, as new studies have shown a statistically significant association between HIV and also the T-cell. This is the highest prevalence of T-cell is mycosis fungoides, is the have the relationship between HIV, because the patient will have a higher prevalence of HIV infection. Epstein-Barr virus is a gamma herpes virus that infects more than 90% of the adult population worldwide. T-cell and epithelial cells are a primary target of EBV infection. Here we can see virus and epithelial to B-cell, and we come the EBV promotes growth of B-cell, priming of T-cell. This is latency, because and after that we come a reactivation and persist infection. This is for the B-cell. How about the T-cell? There is a group of rare diseases characterized by ectopic EBV infection of T or NK lymphocyte that develop in absence of immune deficiency, and that's will become the chronic EBV infection. And after the chronic, it will become the lymphoma. EBV plus T-cell and NK cell lymphoma will become systemic EBV plus T-cell lymphoma, aggressive NK leukemia, and the most popular is extraordinary NK T-cell lymphoma cell type. So what are the purpose of our the research? More examine the relationship between CD30 expression in T-cell non-Hodgkin lymphoma cases with various clinical pathological parameters. Number 2, determine the relationship between CD30 expression and Epstein-Barr virus infection in T-cell non-Hodgkin lymphoma patient. And the number 3, determine the relationship between CD30 expression and hepatitis C virus infection in T-cell non-Hodgkin lymphoma patient. For the method, we collect data in FFP and NHL T-cell from 2016 until 2020 in Sarjito General Hospital. After meeting the criteria, we got 30 samples. The FFP was stained with CD30, NS3, and Eber immunohistochemistry and read by 2 pathologists. The correlation between NHL, TISA, hepatitis C virus, and Epstein-Barr virus will be analyzed statistically using Pfizer exact test and multivariate logistic regression. This is the end of my presentation. Thank you.